back with some important information about gynecological exams. OBGYN Dr. Mel Blackett joins us now to explain what doctors are looking for and what they can find during these exams. Welcome, sir.
Thank you, sir.
Now, the question I get asked almost daily from women is, how often should I have a pap smear done?
Well, traditionally, women are very good about doing pap smears, and traditionally, we've done it every year. In 2012, the supreme body of OBGYN experts, the American College of OBGYN, recommended that before 21, you don't have to have pap smears, irregardless whether you are sexually active or not. After 21, it's between 3 years if you have no prior history of abnormal pap smears. From 30 to 65, you can do it every 5 years if you do some co-testing with HPV, if the HPV is negative and your pap smears are negative. And once you get to the ripe old age of 65, you don't have to have any pap smears anymore unless you have abnormal pap smears in the past.
In the past. Now, I get to ask this question a lot. What about ladies that have had hysterectomies? Say they had a hysterectomy in their 40s, and do they need to still have gynecological exams? Or, of course, there's not a cervix there to do a pap smear on, but do they still need to have an exam?
Yes, they still need to have an exam. I think I need to clarify that a pap smear is not the equivalent of a pelvic exam. And a lot of women mistake that the pap smear means the pelvic exam. They still may need pelvic exams every year, but they may not have to have pap smears every year. Now, if they're hysterectomized, the uterus is gone, the cervix is gone, and there's no history of abnormal pap smears or uterine cancer, there's no need for any more pap smears, and that's the recommendation.
Now, one of the questions that we always ask the GI doctors, if you see any kind of rectal bleeding, what should you do? And the same question I want to pose to you. In a woman that is postmenopausal, that they're done with their periods, they still have a uterus, and lo and behold, one day they see blood, just like they were having a period again. What should be done then?
Well, first of all, they shouldn't panic. But they should call their physician and make an appointment to see their physician. The physician's mindset is, let's make sure this is not a malignancy. So the first priority is to make sure, whether using ultrasounds or endometrial biopsy, that this is not a uterine malignancy. Now,
when you do a gynecological exam in someone that has all their female parts there, and of course you do the pap smear where you're checking for cervical cancer, the other part of the exam, you're checking their ovaries. What are you looking for there?
Well, first you're checking the outside and the vaginal lips. So let's start from outside and work inwards. We are checking the vaginal lips, looking to make sure there are no abrasions, there are no growths, there are no signs of an infection. You're also checking the vagina for vaginal discharge or any lacerations or abnormal texture to the vaginal walls. Then you move into the cervix, and the cervix is a wonderful tool. We have the pap smear, and it can look at pre-malignant cells, precancerous cells, as well as cancerous cells, and that's mainly what the pap smear is for. Then you go into the uterus, and you can size up the uterus and see whether the uterus is enlarged, whether the uterus is tender, whether there is a discharge coming out of the uterus that may indicate an infection. And then last but not least, you move on to the ovaries. The ovaries are very hard to feel, and most of the times you don't get a good feel for the ovaries. But that's the whole concept of a pelvic exam, starting from the outside and moving on until the ovaries are evaluated.
Now, the other topic that usually seems to come up in primary care is the use of estrogen. What is the current thought right now on the increased risk of breast cancer or uterine cancer or any type of cancer from the use of estrogen supplements?
Well, WHO many years ago, it's almost 20 years ago now, came out with a study that showed that estrogen replacement therapy or hormone replacement therapy is not a good thing as you get older. Formerly, we used to try to get everybody as they go through menopause and put them on estrogen replacement therapy. That has gone the way of the dinosaur. And nowadays, if you use estrogen, you use the smallest dose for the shortest period of time. And it's usually used for certain things, not heart disease, not to combat dementia, blood clots, and none of those issues, but for vasomotor issues, meaning severe hot flashes, vaginal atrophy, or the dryness of the vagina. And those are some of the instances where hormonal therapy is used, but it's used for the shortest period of time.
Is there a direct relationship between that and breast cancer?
There is a correlation between that and breast cancer. It's a small correlation, but it's been proven over and over again. So that's one of the reasons why we do it for the shortest period of time.
And be very careful with that.
Absolutely.
Well, thank you so much for being here today.
It's my pleasure.
Coming up on our show, did you know that jaw pain, nausea, and shortness of breath are common heart attack symptoms in women? Stay tuned to find out more about these and other facts about women and heart disease. This is Health Matters.